My name is Aaron Levo. I'm the Vice President of Communications and Public Affairs. Pleased to be with you today to moderate today's webinar, our town hall. We have a focus discussion today around the vaccination policy and what's going on in the area of vaccination. There's lots of questions and we want to make sure we get to all of them. So we will have presentations, and if you do have a question, you can raise it in the Q&A function at the bottom of your screen. You can type the question in, and the presenters that are here with us today will be able to type an answer for you. You can review those in the answered tab. So if you want to see at any moment the questions that have been answered, you can click in the Q&A function on the answered tab and review them. Of course, we'll also pause after our presentations for a live Q&A session where you'll have the opportunity to ask a question live, should you wish, or to type it in, and we'll read it out and get an answer that way as well. And as it always is the case for our town halls, we'll leave time at the end for celebrations, and we'll use the chat function for celebrations. So Q&A function for questions, chat function for celebrations. All right, so I think I've done my part. I'll turn it over to our President and CEO, Rob McIsaac, to kick things off. Rob, over to you.
Thanks very much, Aaron. And good morning, everybody, and thanks for joining today's town hall. As Aaron noted, we're really focusing on our new vaccination management policy, which has now been formally approved. So it's clear COVID isn't finished with us yet. We've got some more rounds left in this fight. The fourth wave is upon us, and case counts are again going up, both in terms of positive tests, but also acute and critical care beds being occupied. We're also facing ongoing and increasing pressures in our emergency departments as a result of the rising numbers. These pressures are steady and show no signs of abating, at least in the short term. Particularly given that we are a regional center, we absolutely have to do all that we can to be prepared for this. We're acutely aware of the impact of these challenges, as well as provincial and national shortages of health human resource, more particularly nurses and some other technology and technician positions. That's why we need to continue to do all that we can to protect our patients and the people who are working at HHS. As you're aware, the vaccination management policy came into effect on Tuesday, September the 7th. And as a leading science-based, evidence-based academic health organization, of course, we are following the science. We followed the science as we implemented IPAC requirements over the course of this pandemic. We followed the science to support the way in which we're treating our patients who present with COVID. And we are now following the science on vaccines. Not only do we need to do our part to implement the provincial directive, directive number 6 from the Chief Medical Officer of Health, and that is the minimum, but ultimately, as the largest employer in Hamilton, I think we also need to be a role model and demonstrate leadership in our community and in our region. We are not asking our frontline team to do more than we are asking of ourselves as leaders. I should note to you that every member of the executive leadership team, every member of our board of directors has been fully vaccinated. I'm also pleased to report that the overwhelming majority of our workforce is now also reporting as being fully vaccinated. We're undertaking this work in collaboration with hospitals across our region and moving forward in a consistent manner so that patients and employees can know what to expect. Of course, we will give everyone sufficient time to comply with the reporting and the vaccination requirements. We will not be unreasonable. We will not be arbitrary. In the interim, those who have not provided proof of vaccination will need to participate in education and undertake regular testing. Ultimately, unless you have a good medical reason not to be vaccinated, or an objection based on your religion as recognized by the Ontario Human Rights Code, We expect that you will be fully vaccinated against COVID to continue to work at HHS. As with any approved policy at HHS, workers who don't respect our policies, who don't abide by them, will be subject to our disciplinary process. That's not an easy message, and it's not a message I really particularly like giving, but it's necessary and it's important given the potential impacts to our patients, given the potential impacts to our workers. Our expectation is that everybody who can be vaccinated will be vaccinated. Our patients and their families need to know we are taking strong steps to protect them. We have a duty as an employer to do all that we can to ensure the safety of our workforce. So we'll be monitoring and advancing our progressive approach to ensure that we are doing everything possible and reasonable to reduce the possibility of COVID-19 entering and being transmitted in our hospital. Again, thanks to all of you for all that you're doing to help keep our community and your coworkers safe. With that said, back to you, Aaron.
Thanks very much, Rob. Okay, great. I'm going to hand it over next to our Vice President of Human Resources, Michelle LaRue, who's going to walk us through the legality of the vaccine policy and some details in that area. So Michelle, over to you. What do we need to know?
Thanks, Aaron. So just a reminder, the Chief Medical Officer of Health has directed all public hospitals to implement these precautions that you'll see set out in the policy that's now available on our policy library. So HHS and our people are required to abide by that policy. The policy is fully compliant with the directive and our obligations to protect our employees, our staff, our visitors, and our patients. It's also compliant with applicable human rights and other legislation. There are allowable exemptions to vaccination as set out in the policy, and there's a process for that. Really important that those who are looking into the exemption piece, please go to the hub where the documents are. There are set out templates that are to be used to bring forward those exemptions through our process through employee health. HHS has received some anti-vaccination objectives that do not raise a valid reason for an exemption under the directive or those applicable laws. And again, just bringing you back to those 2 exemption forms that will be available on the hub or are available on the hub. So requirements of the policy. So Rob highlighted this, but proof of being fully vaccinated against COVID-19 or proof of a documented medical reason for not being vaccinated. So those exemptions again are the forms I referenced, or completion of an education session. In addition to that education session, if you're not fully vaccinated, you will be required to undertake regular testing, and you'll learn more about that as we go further down in the presentation, and my colleague Susan will speak to it. So who does the policy apply to? Staff, physicians, contract workers and vendors, and students, trainees, registered volunteers, and really even businesses and entities that operate on our sites. And just to clarify, we've been asked often, what about people who work from home or work remotely? It applies to everyone regardless of where you're working. Also to highlight, we have a new process for new hires and new physicians and all volunteers as of September 7th. So as of this Monday. So all new hires, new physicians, and all volunteers will be required to give proof of vaccination or a documented medical reason for not being vaccinated. There was work underway with our leaders and our HR team for those who had put in their offers and accepted employment prior to that date to work through the compliance with this new process. So exemptions. So Directive 6, which is what the policy of what we're referring to when we speak to this, requires proof of a documented medical reason and an effective time period for that medical reason. Obligations under the Human Rights Code require that we also consider reasonable requests for exemption under religion and creeds. So that's why 2 processes, and you'll see those processes again on the hub with the applicable forms. So mandatory reporting, step 1. Please, go to the hub, go to the link, you'll see it later in the presentation. Please report if you haven't already. We've got Great response, but there are still some outstanding. So all staff and physicians must report their vaccination status and provide proof of that vaccination status to employee health. If you haven't already, please do so. This is not optional. Leaders will be receiving reports of non-compliant staff, not their status, but who have not reported is what leaders will be receiving, and leaders will be helping support those staff members in a reminder to please go in, as this is a mandatory reporting step. So let's talk about the collection, the use, and disclosure of your documentation. It's all being collected and managed under the Occupational Health and Safety Act and safeguarded in accordance with our PHIPAA practices, best practices. Your vaccination status information and documentation will be shared in aggregate with the Ministry of Health, and that's right in Directive 6. It's a requirement to comply with the provincial reporting requirements under the directive. Managers will also have access to data showing who has completed the reporting, but not what has been reported, in order to assist with and ensure we have compliance with the directive. So please go, if you haven't done so already, right after this town hall and report your status if you haven't. And I think with that, I'm turning it back to you, Aaron.
Thanks very much, Michelle. Next up on deck, we have Susan Fucciarelli, who's our Director of Health, Safety and Wellness. Susan's going to walk us through a little bit about the education sessions that are underway and maybe some other details. Susan, over to you.
Thanks, Aaron. And thanks for everybody who's spoken so far. Michelle has already mentioned around Directive 6. So the education piece comes again directly out of Directive 6. So individuals who are not fully vaccinated will be required to complete the e-learning module that has been developed. Employee Health Services will send a link to those who are not fully vaccinated so that they have easy access. It also provides you with instructions on how to access the e-learning module. It is already now available, so if you have not reported or you're not fully vaccinated and you know that you will be required to do the education module, you can actually access it now and complete that as soon as possible. It's called the COVID-19 vaccine, making an informed decision. So if you go into the LMS system and type in COVID-19 vaccine, making an informed decision, that will come up for you. You can enroll now and you can complete that. Leaders who have staff that has not yet reported, the individual, has not yet reported, will be receiving a list of individuals who have not yet completed the education that are required to do so. And that education module must be completed by September the 24th. In addition, on the next slide, for those who are not fully vaxxed, will also be required to complete home testing. So this will be required twice a week, Mondays and Thursdays. That information and all of the instructions on how to administer that test, which is quite easy to do, as well as how to report the results, are included directly in the kit. Employee Health Services will be sending out those kits to those individuals who will require it. And you may also pick it up at the Employee Health Services office if, again, you know that you're going to be required to do the home testing. All of the instructions are included, and Employee Health Services will be monitoring again to ensure that people who are required to test on Mondays and Thursdays are doing so. Again, the home testing is not to be used if you are symptomatic or if you have had an exposure to somebody who is COVID positive. You should still, in those circumstances, go to Employee Health Services, as you have been doing throughout the entire pandemic, and a referral for a PCR test will be facilitated by Employee Health to one of our assessment centers. Aaron, I'll send it back to you.
Thanks very much, Susan. Okay, continuing on, we're going to talk a bit about compliance and timelines. And to give us an update in that regard is Tiffany Roblin, our Director of Employee Labor Relations and Human Rights. Tiffany, what do we need to know?
Thanks, Aaron. As with all of our HHS policies, compliance with our vaccination management policy is required. Failure to comply with the policy may result in an unpaid leave of absence until the individual becomes compliant, and may also result in progressive discipline up to and including termination for that ongoing non-compliance. It is important to note that for those individuals who are not fully vaccinated and are required to comply with the antigen testing requirements that Susan has just walked through, those employees who must miss a shift as a result of their failure to comply with the testing requirements will not be paid for any missed shifts. We do also want to note for those who have a missed shift, where there might be applicable premiums for shift cancellation requirements under a collective agreement or otherwise, those premiums are also not payable. While the policy became effective on Tuesday, September 7th, we have a staggered approach to that implementation, as we briefly spoke to, and those compliance requirements. As Rob mentioned, we are giving folks reasonable time to become compliant with our policy and the obligations under Directive Number 6. We will not do so unreasonably or arbitrarily. This week, test kits continue to be mailed out to those who have reported that they're not fully vaccinated or have that approved exemption. Leaders have also begun to receive reports to assist in enforcing the policy. These reports simply note whether a team member has reported their status or not. Throughout the week of September 13th, we'll continue with our efforts to attain that compliance. Those test kits will continue to be issued to those who are required to test, and we'll continue to work with leaders to ensure folks understand the requirements of the policy. Effective September 21st, compliance is required. All staff and physicians must be in compliance in either the reporting of their status, or for those who are required to test, those expectations to test, as my colleague Susan mentioned, is those folks are testing on that periodic basis set out. Beginning September 21st, we will begin to work with leaders on actions required for those who remain non-compliant. As I just mentioned, this may result in an individual being placed on an unpaid leave of absence until they become compliant, and may result in progressive discipline up to and including termination for those who continue to be non-compliant. As always, all of this information is available online for everyone to access. The link is on this slide. You'll see those updates on the daily staff updates through the hub, through email and otherwise, but please make yourself aware of the policy if you haven't had a chance already to read through, so that you are familiar particularly with those compliance mechanisms that I've just spoken to. And with that, I'll hand it back to Aaron.
All right, very much. Thanks very much, Tiffany, and to all our presenters. So we're making good time today. We'll have a chance to answer some questions. I know our panelists have been busy responding to questions already in the Q&A section, and you can take a look at those that have been answered, just clicking on the Answered tab at the top of the page when you open the Q&A function. There has been some discussion about vaccine safety, about the cost and no cost to the employees of the testing kits, as well as some other matters. One of the things that keeps coming up is just thematically is the issue of whether people who are on leave or vacation do need to, how will they submit? I don't know, Susan, maybe, I think you answered this question last time, if maybe you want to address it again, just specifically to underscore for those that have asked that question, somebody who's on vacation or on a leave or perhaps on a maternity leave, what's their obligations around disclosure and vaccination?
Yeah, so certainly for those individuals who are on leave and may not be aware of this requirement, we are looking at the list and we're sorting out those who are on leave. For those who are on vacation, again, the reporting has been live for quite some time now. So we will be following up with those who may have reported but not have yet submitted their proof. But certainly we'll be looking at those exceptional circumstances.
And what about in those instances of somebody who's doing the testing, would they also need to submit their test results holiday, non-holiday, just it doesn't matter?
So again, I think for the testing, we expect to be reasonable here. So if you're on vacation, you wouldn't be expected to test. This is really to ensure that if you're coming to work that you have tested. And again, if you're coming to work at a hospital or if you're working even remotely.
Gotcha. Okay, thanks very much. There is sort of a theme around questions around adverse reactions. And hey, if I get the vaccine, I have an adverse reaction. What happens to me? Like what goes on there? I wonder. I know we have some of our experts in the area of vaccine with us today. I don't know if Dr. Mertz or Dr. Smale can talk a little bit about the safety of the vaccine and how that's been validated. I mean, currently, we do have a mandatory vaccination for employees for other things. I imagine we would treat any potential adverse reaction the same, but what would you have to say from a medical standpoint about the likelihood?
Yeah, I'm happy to quickly weigh in. There's been study published, I believe, only a couple of weeks ago, and my recollection is I read a lot lately, but I think it was in JAMA, looking at millions of vaccines that had been administered and comparing that to a control group that didn't have recent vaccination. And there's pretty much no signal for harm in there. The one signal we know is the risk for myocarditis, which is rare, but has a relatively higher risk among the younger population, and in particular males. So that's certainly one thing that's out there that we need to be aware of. And I think most people are aware of those risks. But beyond that, there's basically no major signal for Pfizer and Moderna vaccines out there. AstraZeneca we no longer use, given the availability of the mRNA and the better safety profile that we have with the mRNA vaccines. Then allergic reactions, severe allergic reactions, extremely rare as well. Yes, they do occur, but they occur very rarely, and as you know, can be treated. And that's why we typically advise people to wait at least 15 minutes after having received the vaccine. Despite the fact that there's a lot of noise out there about reported side effects, once you compare those those deemed side effects to what other people happen to have at the same time who haven't had a vaccine, you don't see a signal, and that's very reassuring.
Okay, well, thanks very much, Dr. Mertz, for that explanation around safety. One of the other themes that's coming up in our questions is around the issue of religious exemption. I wonder if one of our HR team experts could weigh in on this when an individual might be seeking an exemption on religious grounds. What does that process look like, and how did we arrive at that process?
Thanks, Aaron. So I'm happy to speak to that. I think, as folks might be able to appreciate, this is being worked through as those exemption requests are being received. They will be evaluated on those case-by-case bases, so with the supporting documentation that folks are providing. I do encourage, and I will answer and provide the link in some of the Q&As that are happening, but I do encourage folks to familiarize themselves with the advice that is coming out from the Ontario Human Rights Commission in this space as well, as it relates to those religious and creed exemptions. We do often look to the Ontario Human Rights Commission and other pieces of legislation to help inform us in this space.
Gotcha, okay. There is a question here, just diverging a small amount from vaccine, just around the issue of the procedure backlog, wave 4, what's going on in our environment. I know just today our COVID Command Center met, and we're talking a little bit about the demand on our services. I wonder if Sharon Pearson's with us, if you might comment, Sharon, a little bit about the planning that's underway to manage wave 4, where we're at in terms of our overall volumes and what you see ahead. And Sharon might not be with us today. I know.
I am, sorry about that.
Oh, great, there you are, thanks.
Yeah, sorry about that, it's just on mute there. We are doing active planning for the wave 4 activity that we're seeing. Just so we didn't do an operational update today, but just a little bit of detail around our ED volumes that we're seeing right now. We have gone back to our 2019 volumes. So in 2020, we saw a bit of a dip in our activity of about 20%, and we have now gone back to seeing those patients again and a little bit beyond that. So I know our EDs are feeling the pressures. I will also point out that we have not yet resumed all of our pre-COVID surgical activity. So we're already operating below our general activity at our sites, yet feeling the pressures that we have had. So we have had to cancel on occasion over the course of the last few weeks. We are working with our regional partners as well. Everyone is feeling much of the same stress, but we are looking to opportunities to manage and census balance across our sites as well. In an effort to reduce the pressure, particularly on our regional programs at the General, the Juravinski, and of course at McMaster as well. There is a COVID capacity planning table within the HNHPB, and we are looking at how we will manage particularly ICU volumes across all of the respective hospitals within the HNHPB. So more to come about that.
Thanks very much, Sharon. I wonder if we might also here just I'm just trying to keep up with the questions here. There's a lot coming in, a lot being answered. Again, encourage everyone to take a look at what has been answered in the in the answer tab, and a note to our participants that you can also raise your hand in the attendees function, and we'll call on you to ask your question live. Maybe just a question here about, you know, it is a fact that we have short staff situations. So as we're thinking about escalating through the disciplinary process, ultimately we don't want to end up in the position of short staffing due to vaccination. Like, how are we thinking about striking that balance? I wonder, Michelle, if you might want to comment briefly on that.
Sorry, Aaron, I was typing in an answer to a question. Can you?
I know how it goes.
repeat
It happens. Thanks very much.
Sorry. Can you just help me with the question again, and then I'll do my best.
I'm so sorry. So one of the things that's coming up as a theme in our questions is just the issue around, oh shoot, this is a brain moment here. I totally forgot the question I asked.
Well, perfect. Then we'll just assume I answered it and we'll move on.
Of staff shortages, and just, you know, already I think we have staff shortages that we struggle to fill. And as we go through this process of trying to escalate our disciplinary process, and we see the kind of the option of termination, or I guess leave without pay, is really what we're looking at the end of the day. Like, what's the balance we're going to try and strike? I know ultimately we want everybody to get vaccinated, and that'll be the best solution. But how are we thinking about that?
You know what, Aaron, that's a great question. So all I can say is that you're right. We understand, not just at HHS, but across the region and across the province, that there's staff shortages, and we know how hard it is on everyone who's doing their best during those shortages to be able to cover. So again, all I can say is that this will be something we implement in a progressive way, being thoughtful. Nothing, as Rob mentioned in his opening comments, we're going to take, we're not going to be arbitrary. We're going to take the necessary steps and before we move anywhere to termination. And we're hopeful that, again, everybody will be on board towards our 100% vaccination goal. But we're not alone in this. You have to remember that the other hospitals are in the same, many of the other hospitals are in the same place and are moving towards us. Some of them even have already gone in this direction. So we've got some time, and we'll just take it day by day. But thanks, Aaron.
One of the other things, just while I have you, I mean, I see a theme in the questions occasionally around the issue of, hey, I can't be forced to get a vaccine. I can't be forced to take a test. How do you, how is this legal? And I mean, you somewhat addressed this in your slides, but maybe if I could ask you to underscore, I mean, it is a choice for people, but the fact is, if you choose not to engage in those activities, ultimately it's your employment that's at risk because your employer has a requirement. So I think there's a distinction to be made between forcing someone to do something and their employment maintenance. I mean, you commented on this, maybe you could just underscore that just for those, the benefit of those that might be asking the question now because maybe they missed your slides.
Oh, thanks, Aaron. And you've said it, I think, better than I could, but you're right. This is a directive that has come down. This is an HHS policy. And like other policies, we need people to abide by them. There's other testing that is mandatory testing that's done when you're hired, you know, outside, that has been in place for a long time. So again, you're right. We just need people to understand that this is a policy we require everybody to adhere to. It's part of their employment.
And I do see as well in the questions, as just thematically trying to get through, there's some that are kind of repeating, trying to get through some of these the best we can. Just wanted to underscore for people the issue of reactions or medical exemptions, which have been raised in our Q&A. There are provisions for those and a process, and all of that information is available on the hub and has been sent out in our dispatch every day since we began the implementation of this policy. So you can look there for more information about that. Okay, getting back to the questions. Sorry, team, having a hard time keeping up with these today. There is a lot of questions. We want to make sure that we get to as many as we can respectfully. So just give me a second here, taking a look. Okay, there seems to be an ongoing dialogue occurring. Some might want to review the answer tab for the answers to some of the questions that are being posed are in there already. One here about, aside from the issues, we raised the issue of allergic reactions, what about phobia to needles? I wonder if one of our medical practitioners can speak to that. What are the practices we might employ to support someone who has a phobia about getting the vaccine? Certainly this would be the case in our broader population as well. What can be done to accommodate individuals with that phobia?
That would probably be a question for Fiona if she can answer it, because she worked in the vaccine clinic quite a lot. I didn't have time to do so. Fiona, can you comment on needle phobia?
Yes, in terms of individuals with vaccine phobia, there are in fact some special clinics that have been set up that we could put staff in contact with, just regarding following a very appropriate process to support the individual around any needle phobia. My approach when I was seeing these individuals was to really address their fears and recognize what the issues are, and then in a very compassionate way support the vaccination. But we can look at setting up something probably through employee health with some additional support around that.
Thanks for that, Dr. Smale. Another question here about following up with physician leaders. I know we've talked about our workforce and managers receiving reports in the areas that they oversee about how to follow up with staff. Is the same true for our physician leaders? So they would be following up with physicians in the same regard. I see Dr. Stacey's come on camera. Michael, can you shed some light on this?
Yeah, thanks. Thanks, Aaron. Yeah, I mean, I think the essence of this policy is this applies to all staff and all people who work and come into our organisation to work. So the same applies to physicians as it does to other staff. So yes, you know, where there is non-compliance with the policy, physician leaders will follow up with the physicians on that, just as will happen with managers and directors with other staff.
Yeah. There's a question here about, does compliancy mean reporting status and getting tested, educated, or is our ultimate goal to have everyone get the vaccine? I think our communications have been quite clear that our goal is to get everybody vaccinated who can be, recognizing though there is an exemption process, and there will be some, although we expect a very slim minority who will be a part of that exemption. So I think that's the goal. Let's see. Questions about how many people have responded to the survey to date. I've seen that come up a couple of times. At this time, we're still getting responses. And so as Tiffany outlined earlier, September 21st, we're really hoping to have all of our responses in. And we'll look to answer that question when we have all the data and we can do so accurately. So I can say that right now the response has been very, very good. Lots of responses, but we still have some to collect. So we want to get to that finish line before we talk about that specifically. So again, another one here about vaccination, about the status of our reporting, about what we're seeing at other hospitals. I think similar case. See some of our team is typing answers to the next few questions. Why is the antigen test policy contradicting what's been addressed today? It says employees working exclusively. No, we're not going this way. So does the issue of people, those that are working offsite are not required to self-test? Can someone address that question for me?
Yes, Aaron, I've answered that in the Q&A as well. So, but just to make it clear, it does appear that we do have an error in the FAQ. So we will correct that. All staff who are not fully vaccinated, regardless of whether or not you're working remotely, are required to complete the education and the home testing. Okay. I apologize for that error.
And what about here? There's another one maybe that you can answer. What would be the recourse if someone just simply said, well, I'm not going to get tested? I think that's a question here.
Right. So if somebody chooses not to get tested, their leader is going to be notified, and that's going to follow that compliance and discipline route that Tiffany outlined.
Okay, great. Okay, so I think I'm seeing a lot of themes. Does age have a deadline for vaccination? I think as Rob outlined at the beginning, we're progressing through the process. We need to get in all of our data. and Tiffany has talked about a deadline for that on September 21st. So we will continue to do town halls of this nature to make sure we're addressing all these questions and making sure that we get the most latest and updated information. Still some here about the deadlines in the screening form. I see those are coming up. So I'm going to suggest maybe we move forward towards our celebrations, recognizing I see that a number of our questions are being answered by our experts, and I see some that have been answered already. We're up to 50 answered in the Q&A tab, and that's really great. I appreciate the participation today from everybody and our panelists' hard work to answer questions. As always, you can send questions in between this and our next town hall to the HHS News at hhsc.ca inbox. You can also, we will use that information to craft the material for the next town hall, and we'll try to get answers to people in between now and then as well. And we'll use those questions that have come up in our Q&A today to do the same. So thinking about our celebrations, this is a part of our agenda we like to reserve to give a shout out to people or projects or teams, things happening across the organization that you want to remark on, that you think are exceptional or have gone above and beyond in service of our mission. So you can do two things. You can type something into the chat forum and we'll read it out. You can also raise your hand and we'll call on you to give your celebration live. Our panelists are also welcome to provide celebrations. So we'll just see here if we have anybody popping up. Okay, well, maybe I know it takes a minute. Sometimes somebody's typing. Betty N is here. Thank you for our leadership on taking on the vaccination policy. Thank you to Betty for that. And we'll do one last call out then to our participants, if anyone would like to raise a hand, or to our panelists. Sharon, I see you've come on camera. Is there something you'd like to call out today?
I would, and seeing Betty's name brought it certainly closer to my thoughts, although always thinking about it is our great group of site admin managers we have working in the day and after hours and on weekends to try to keep our sites running smoothly. And many people don't know probably what they do every day, but it's a very difficult task being a single person across many sites, trying to keep flow going and units staffed and respond to all the crises that can happen during every hour of the day. So many thanks to a very small group within the site admin managers.
Perfect. See a shout out here from Kyle McLean. Shout out to all the teams supporting and implementing the ever-changing provincial directives. Significant effort goes into these directives and involves many teams from across our organization. Certainly a great point, Kyle. I know everyone's had a lot on their plates keeping up. Thank you for pointing that out. From Andrea Frolick, thanks to all of our NRT staff who are filling staffing gaps around the organization in a very challenging clinical environment. So grateful for your professionalism and flexibility in meeting patient care needs across our system. Thanks very much, Andrea, for making that shout out. From Harjat Olak, I'd like to provide a shout out to Jeff Mullaney on the safety team for all his hard work on the implementation of vaccine reporting. Thanks very much for that, Harjat. And I see Kirsten Crowley, you've got your hand up. What would you like to celebrate today?
Hi. I just wanted to shout out the security folks, our professional security team. They're amazing. I see them often in our hallways, have a chance to chat with them, always friendly, but what they deal with day in and day out is pretty phenomenal. Code whites and all sorts of different events that are happening. And of course, having the skills and abilities to also understand all the PPE use, but also how to de-escalate situations, be there for the patients and families, but also for our team members. They're awesome. And I'm so grateful for what they do every day in our organization. Thank you.
Great, thanks for that, Kirsten. Okay, well, I think we'll bring things to a close there. I know our panelists, they've answered 5 more questions in the time that we've gone through our celebrations, so you can review the answers there. We will, of course, provide today's town hall recording out to the organization if you'd like to refer to it. Maybe with that, I'll turn it back over to you, Rob, for some closing remarks. Thanks.
Thanks very much, Aaron. Thanks all for attending today. Look, I know this is not the most popular thing to be doing, and that was reflected in many of the questions today. Lots of kind of technical legal questions. It is not appropriate for us to be providing legal advice in the context of a town hall. But what I will say is this, look, we are living in a very imperfect world in a very imperfect time, and we simply have to do our best to make the workplace as safe as we can for both our workers and our patients. We are looking at the science to help us to come to those answers, and as well as following the very clear requirements of the directives of the Medical Officer of Health for the province of Ontario. So we are doing the best we can in an imperfect situation, but I do believe what we are doing is the right thing to do. So thanks all for listening in today and for engaging in the discussions. We will continue to monitor the outcomes of the current policy and make adjustments as appropriate. So thanks all for attending today, and we'll see you next time.